Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms. Hello.
Hello.
It was very robust.
I know, it was.
All right, so today we are talking about when work is not supportive.
Rude.
I know. Did you ever work for a company that didn't support you?
I learned pretty early on not to do that.
That's not true. We talk about it later.
Okay, so the only time I've ever worked for a company that didn't support me, it's because of a change in management. I'm not going to out this. I'm not going to out this business, but
well, you can keep it simple.
They changed management. I loved them. They were very supportive. Loved them. I love them a lot. And then they changed management, and they were no longer supportive, so I left.
Yeah.
Yeah.
Well, that's a tale.
So yes,
that's a tale as old as time, Sarah.
Right. Yeah.
Like new management, changing of the guard.
Yeah.
I was actually talking to somebody the other day. They were talking about how their company has a new president and how he's basically going around screwing up everything that works. And I said, well, that's what they do. They come in and they got to pee on every tree.
Yeah.
Right?
They got to put their stamp on it.
They got to put their stamp on it and say, look, I'm the new guy and I'm going to do all this stuff new and it's going to be my mark on society. And it's like, instead of just keeping what works and revising what doesn't, they got to go around and change it. So tale is all the time when management changes and it's no longer good, right?
Yeah.
I've worked for so many companies. I mean, when you say didn't support you, I mean, it's just like, that's such a loaded question, right?
Yeah.
There's so many companies.
It could look like you're within your job, they don't support you, or within your like personal life, they don't support you. Cause I mean, it could be, they could be like, super supportive within you getting your job done, but not care anything about your personal life. But,
I mean, and it means so many different things to different people. So today we're going to actually talk to a doctor who has had breast cancer twice. She had a recurrence. She's dealt with this twice. She asked for an accommodation after chemotherapy, and then she found herself at risk of losing her job, which sadly, I'm not surprised by that. And at the same time, it's just like, for God's sake. I mean, a doctor of all professions, a doctor's dealing with this.
Yeah.
But I thought that was super interesting. So we're going to talk about, kind of what her work life was like before diagnosis.
And then we're going to talk about how work responded during treatment.
Yeah. And then finally, we're going to ask, what happened after treatment that prompted her to ask for a reasonable accommodation and what her company's response was.
All right. But before we do that, let's hear from our first sponsor.
Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at www.coldcap.com. All right. Kathleen, thank you so much for being here. We really appreciate you sharing your experience.
Well, thank you for having me, Beth.
Of course. Okay, so you're an ER doctor. Can you kind of explain what the environment's like in the emergency room? I can only imagine, what that's like.
I mean, our environment is always fast-paced, chaotic, especially the last couple of years with COVID. It's really kind of changed the pace of what we normally see in the winter. I mean, right now, the COVID spike is back. We're seeing so much flu right now. Everybody's sick.
What are the hours like? I mean, first of all, how long have you been an ER doctor? How long have you been?
I've been an ER doctor, including residency. I've been doing this for 20 years. I
Okay.
mean, it's always shift work. No, I've never worked in a place where it's 24 hours straight, but some of the smaller rural ERs will staff their emergency rooms with physicians for 24 hours straight. In the big city, they tend to range anywhere from 8 to 12 hour shifts. We have stagnant hours, or not stagnant, but rotating hours would be a better description. The first shift starts at 7, the last shift starts at 9 p.m. And that's the overnight shift, 9 p.m. to 7 a.m.
Is it stressful? Do you find the work stressful?
It is stressful. I mean, especially when you're the only doctor there. And sometimes if you have 2 or 3 critically sick patients, there is stress with that. Absolutely.
Do you feel like, and it doesn't have to be now, but do you feel like when you first got in it, you kind of thrived on that kind of, maybe not, you didn't enjoy it, but like that pace, that environment of like something always new, something interesting that's going to challenge you or make you think would come in? Was that how it was like in the beginning?
Absolutely. I mean, the standard joke is that all of us who do emergency medicine have a little bit of ADHD. We like the unpredictability. We like not knowing what's going to come in the door. We like the sick cases because they challenge us to be fast on our feet, work to try to stabilize them, get them better.
Yeah, I could see how that would be really rewarding and just interesting. I mean, I share that ADD diagnosis. It's like every day being different is like what I love. I mean, I love that. So I could totally see that. So you've been doing this 20 plus years. So it's like, when you got your breast cancer diagnosis, you were working as an ER doctor, correct?
Oh, yeah.
So when were you first diagnosed?
I was first diagnosed in January 2018.
Okay. And they caught it pretty early, correct?
Correct. That was a DCIS diagnosis.
Okay. So it hadn't expanded beyond the duct. You could just have surgery. And theoretically, I mean, most of the time they say that's curative. That's usually how they kind of present it, correct?
Correct.
Okay. So that you had that. You thought, okay, I'm going to leave this behind. Was your work supportive when you had to go through your surgery and kind of take care of all that?
Work was actually very supportive. I was rather new at the hospital that I was at. They provided advanced sick leave. I could easily, because I did end up with a mastectomy with the DCIS diagnosis, they provided I can't remember if it was 4 or 6 weeks, but a paid sick leave, which, is...
Yeah, a lot of people would love to have that. So that's great for recovery.
Absolutely.
Okay, so you get that first diagnosis, you go back to work. Did you feel like kind of you were fine to go back and everything was good because they caught it early and you didn't have any major complications?
Absolutely. Obviously, the physical complications from healing. So when I went back to work initially, I was kind of eased back into it just because of the issues with shoulder pain, difficulties just moving that shoulder and arm.
Sure. And then you had a recurrence, right? How did you find out that you had a recurrence?
I did not feel the lump. It was in my mastectomy breast. It was caught on my yearly MRI. The thing that nobody ever told me till after the reoccurrence is that I was supposed to be doing breast exams on my mastectomy breast, which I
didn't think that was a thing. I did not.
Oh, really?
No.
Oh, yeah.
Yeah, well, nobody.
Oh, I mean, I guess
nobody told me that. And my assumption as a doctor was when you have a mastectomy, all your breast tissue is taken out.
Yeah, what are you feeling for? Unless there was residual, like
breast
if they
tissue.
didn't get good margins and you had no more, I mean, I wouldn't have thought there'd be anything to feel for.
Well, what I learned from the surgeon is that they can't remove all the breast tissue. They leave a small percentage behind.
Okay. All right. So you have your MRI. They tell you there's a lump. How did that feel hearing that news for a second time?
Absolutely devastated. I mean, absolutely devastated. You think you are done. Devastated because I didn't realize, because I thought mastectomy would be not like there was a possibility of reoccurrence 2 years later.
Right.
Yeah.
So when you recurred, did you have to do additional treatment?
Yes. I mean,
You'd already had the mastectomy. So were they recommending chemotherapy and then radiation?
Yes. I mean, I had a lumpectomy on the mastectomy
Oh,
breast.
man.
The oncotype score was actually kind of, I'm going to say through the roof, but significantly elevated. I mean, I was in the mid 40s and,
Oh,
any
boy.
that high gets chemo and gets radiation.
Sure. So you go through that because I want to
Yeah.
know how your work responded when you came back and said, "Guess what, guys? I had a recurrence and now I have to do treatment again." Was the response the same? Were they supportive?
They actually were supportive. This was right before, COVID. This was fall of 2020, before the COVID vaccine was even out there. My boss arranged for me to work from home because we knew chemo was coming and he didn't want me in the ER getting COVID.
So you went through everything at the height of the pandemic?
Correct.
Okay. So here you are, you're an ER doctor in a very stressful environment. You get this recurrence. You're going to have to go through everything during the pandemic. Sounds like your boss was very anxious about you getting sick within the ER. So he's got you at home kind of working from the house until everything starts. You go through treatment, which, many of us have. Chemotherapy, radiation. I want to talk a little bit about what recovery was like once you went through that process. But before we do that, you want to do Boobs in the News?
Yeah, that's right.
Boobs in the News is a fun segment where we read funny tweets by real people or ridiculous news stories.
Bibs in the news, bibs in the news, bibs in the news.
Here it is. I want to know how you feel about this because I bet you have an opinion.
Always.
You live with somebody that loves to change his facial hair. So this is why I want to know about it. So this title says claim of a new world record for longest beard chain in Wyoming.
Interesting.
Can you see this picture of these guys?
Oh, it's actually not as long as but
They tied themselves together with their beards. So they're all standing in a line and they tied their beards together and they're trying to win a world record.
Oh,
so
that kind of chain. Oh, okay. They've split their beard in half and then they're like, they tie it to the person next to them.
So
Yeah.
it says, this is Casper, Wyoming, which first of all, I'm not hating on Wyoming, but if you've been to Wyoming, there's not a lot to do there.
Oh, well,
Especially in Casper. So I'm not going to fault these guys right out of the gate because they got to find entertainment any way they can. And if this is it, that's my stance.
Good on them.
It says facial hair enthusiasts claim to have set a new world record for longest beard chain during an event in Wyoming. This is from the Casper Star Tribune reporting. Participants gathered at Gaslight Social, a bar in Casper, where they stood side by side and clipped their beards together to create a hairy chain that was measured at 150 feet long. That's more than double the Guinness World Record of 62 feet 6 inches set in Germany in what year, Sarah? Do you want to guess?
Oh, gosh. I don't know. 85.
Nope, it was more recent than that. 2007.
Oh, okay.
All right. So to participate, people needed to sport a beard at least 8 inches long.
Participation requirements.
Yeah. Oh, yeah. No, this was like
Prerequisites.
So my question is, would Eric do this? Because every time I see him, his facial hair is different. He's never done a beard.
He's a mustache.
He's a mustache guy.
Yeah.
I don't think I've ever seen him with a beard.
No, he can't because he can't put it. He can only do a mustache with the fire department because he can't put his.
Oh, his mouth, his respirator on.
Yeah.
Over it.
Yeah.
So that's what keeps him from doing it.
Yeah.
Oh, I bet if.
But when I feel like at one point, maybe it was during first maternity leave, he grew out his beard as long as he could. But I mean, it was like
he's so fair. I can only see I would think he'd like grow one of those like.
No,
blonde beards.
He's got
some hair.
Yeah, it's dark. I mean, it's the same color as the mustache, which is brown.
Okay.
Yeah.
All right. There you go. There's your boobs.
Yeah. Silly people.
Bibs in the news, bibs in the news, bibs in the news.
All right. So we're back. You go through chemotherapy. You go through radiation. How much time? Usually it takes 8 months. Like
for chemo?
Close to a year. I mean, depends, I guess, on how many rounds you need.
Yeah.
So how many rounds of chemotherapy did you end up doing?
I ended up doing four rounds of chemotherapy because there is no standard of care for what should be done on a reoccurrence on a mastectomy breast, which is
Interesting.
I had chemo from November through February because of insurance. Radiation didn't start until March and was basically through March. I was off through chemo. I went back to work because in all honesty, nobody ever suggested taking further time off during radiation, which I barely made it through work. Mm-hmm. Luckily, we had a very wonderful night doc who once, 9 o'clock turned around because I could have fallen asleep, honestly, at the desk by 8 p.m. He's like, just go home. I've got it.
Oh, okay. So you were kind of feeling a little drowsy by 8 p.m. and you had a doctor that was advocating for you by saying, "Hey, I got this hour, go home."
And this was at the end of radiation.
This was during all of radiation.
Oh,
because you went through chemo, you were off for chemo, you came back for radiation. Because that's what I did. I went back to work for radiation.
I did because, everybody makes radiation seem like not a big deal. And, and at least for me, radiation, the fatigue was incredible. I mean, I felt nobody feels great during chemo, but I felt like radiation had more lasting effects than what chemotherapy.
Yeah, it's interesting. We do have women that feel like radiation is worse for the fatigue than chemo. So it's always fascinating to me when people have different experiences. When did you start noticing cognitive issues, or when did you start struggling? We talk about chemo brain a lot, and we kind of make light of it like chemo brain. And really, I've kind of come to this conclusion that it's kind of brain damage. I mean, I don't like saying like, hey, you might suffer some brain damage from putting these chemicals in your body. Do you feel that way? I mean, it's cognitive decline from treatment, and they call it chemo brain, but I mean, it's a significant quality of life issue for a lot of us.
I totally agree with you on that. First off, if you can't stay awake, I mean, it was struggle to, really function during radiation.
No, nobody's doing well when you're not getting good sleep too. Can we tell you? Yeah. Can you tell you that? I mean, everybody knows the importance of good quality sleep. And when you're in treatment, it's a different kind of sleep too. It's not good quality sleep.
I lost my ability to sleep during chemo. I mean, it was awful. I only slept thanks to prescription sleeping medicine.
So how long after so you go through radiation, you're really struggling, but you're back in the saddle, you're trying to make it work. When did you realize, like, I need some help? Like, I need them to work with me a little bit about what my life looks like? Because I feel like a lot of us, you are forever changed after you go through treatment. You just are, either emotionally or physically or both. When did it start dawning on you that you couldn't keep sustaining the pace you had been, accustomed to, or that you had done in the past?
In all honesty, it was during radiation. I mean, just because the fatigue was so dramatic during radiation, I knew I could not go, come back and do, the shifts that lasted till midnight, the overnight shifts.
Yeah, because you got tasked with a lot of overnight work, and that was kind of where the problem was, right? So when you got done with radiation, did the symptoms resolve to a certain degree, or did it continue to be that crushing fatigue? Because a lot of times it'll improve for people, not necessarily as good as before, but better.
It was not the crushing fatigue, but the fatigue really hit in about like 8 p.m. The needing like to take a nap at, anywhere between 2 and 4 p.m. was not there. But my ability to function, and I'm not even going to call it late at night, in the early evening was the issue.
Okay. So here you are in an industry where they have night shifts, right? They have day shifts, it sounds like. And you felt equipped to do the day shift, but the evening presented a problem for you. And you said, what? You went to your boss and said, can I please not work past 9 o'clock? Was that the ask?
Yes.
And how was that received?
It was received well. I was told, sure, whatever you need. Well, I was put on, shifts that ended at by 9 p.m.
Okay. So when did things change?
This has been going a year and a half with these unofficial accommodations. I ended up working with an occupational therapist December last year with the brain rehabilitation, who suggested going ahead and making formal accommodations, because she said that the later it gets from finishing chemotherapy, it's harder to prove that the chemotherapy is what is affecting your brain.
Which, what I think is super interesting about that is that I felt like my chemo brain to some degree got worse the further away from treatment I was, not better. Like, I think that's interesting.
I think we didn't touch on this. Did you end up going on hormone therapy too?
I am on an aromatase inhibitor.
Okay.
Because that leads...
I feel like that also, for me, that was... I mean, and it could have been like tit for tat. Who knows what it was actually came from? But like, I feel like it was the aromatase inhibitor that actually was causing a lot of, like crabby, but also just like tired.
Cloudy. I said cloudy, not crabby.
I mean, I was crabby too, but I think it just like, I don't know. It had a impact on my cognitive function, but also on my fatigue. So here you are. You're more than a year out from your treatment. Are you still noticing with the accommodation? Are you still noticing even when you're not working that you still have this fatigue?
Oh, yeah.
It's chronic. It's a chronic condition for you at this point.
Yeah.
Chronic. I mean, if my kids would go to bed at 8:30, I would fall in bed right behind them.
Okay, so you're a therapist. You worked with somebody on brain rehabilitation, which is a thing, people. So if you're dealing with cognitive decline or you're having some issues, there are therapists that will focus on helping you. And obviously with your work, you know, I could see, Kathleen, how you would really want to work with somebody to get you in the best shape you could get. And she's recommending, it's her professional, recommendation that you get a formalized accommodation. And so when you went to go formalize that request, that's kind of when everything went sideways.
Everything went initially. Actually, I was well supported by my boss. Yeah, because there were fellow physicians who were complaining that I was getting preferential treatment and he really wanted to stop the complaints. So when I approached him about getting this officially formalized, he was like, that is a great idea. That will get people off my back, from complaining that you are getting preferential shifts.
I want to know who these coworkers are as human beings who are mad because the chemo patient asked to not work past 9. I'm sorry. That's just...
Yeah. Well, but you know what? This happened. I feel like I see this a lot in people is that the farther you get away from cancer, like they forget
think you're fine.
They forget that happened and they think they're fine, especially somebody who hasn't been through it themselves.
No, that's so true.
Yeah.
People think it's just a one and done and it's over. You're right. 100%. Okay, so he goes down the line of trying to get you formalized accommodations. What happened?
This has been a long, drawn-out process, first off, just to paint this picture. But, the formal accommodations finally got in after people saying, like, they were lost in March. I got a letter in July from the hospital, basically requesting what they call a fit for duty, stating that my inability to work nights was affecting the mission of the department and that, the mission of the department couldn't be affected.
Yeah, they're trying to say basically like you're trying to change the job.
Yeah.
So then what happened from that is because, again, I went through their physical exam, which was nothing cognitive. Their fit for duty exam was all a physical exam.
Which you're pretty in shape.
Right.
Oh, yeah.
Yeah.
You're a very fit person. I'm like, but how interesting that you're saying, hey, I need some help, with something from treatment cognitively, and they're like giving you a physical exam. I mean, isn't that just speak to the system?
Yeah.
Oh, totally. They want to, can you lift your left arm above your head? Yes, that's not.
Yeah.
Great. I can lift 50 pounds. You know what I mean? Like, that's not what we're talking about here.
I ended up filing an EEOC complaint, basically stating discrimination because chemo brain is covered under the American with Disabilities Act. And if you are employed by a company, and I believe it's over 25 people need to be in the company to have enough people that they can follow ADA guidelines, they are supposed to reasonably give you your accommodation, unless they say the accommodations you request are such a blow to whatever the job is, that we can't function, we can't grant them.
Right. And this is kind of where you're at in the process right now. Like, it hasn't been resolved. You're kind of in no man's land waiting to see, are they going to do what they, in my opinion, should do? Mm-hmm. Or are they going to force you out? Right. I mean, that's kind of what you're waiting with bated breath to see how big of a hill are they, what are they going to do?
It's actually slightly farther than that, so at this EEOC meeting, the boss, who was very supportive, came out and said, oh, no, we can't grant those accommodations. So what I am in right now is the accommodations of what they call last resort, which is 40 days to try to find me a new position in the hospital.
That's how they force you out. That's what they do. They'll say, oh, well, we tried to find something that fits your skill set, but we couldn't find it. So unfortunately, you're now without a job. That's what they do.
Oh, I either have to, if I wanted to stay employed where I am, I either have to withdraw my accommodations and go back to work, these late shifts, which just I feel like I can't function as, or they are going to quote unquote medically retire, which is, in my opinion, medically fire.
Wow.
That is like, okay, that's dangerous for you.
Yeah.
But it's also dangerous for the patients that you take care of.
Well, I mean, not in their view. Their view is they're getting rid of the problem instead of making it an accommodation so she can provide adequate care.
This seems so silly.
I mean, it's the world. This is the world we live in. You perform or, you're gone. And if anything, outside of what we want isn't possible, then, you're replaceable. I hate that you're going through this. Unfortunately, you're not the first person nor the last. I mean, right now I can think of 3 other women that are basically being forced out of their job for asking for similar accommodations. And these are high-powered, just like you. They're ballers, man. They've got these really long, illustrious careers where they have been running themselves into the ground for 20 plus years and doing everything they can, for the bottom line. And the minute that they said, I'm struggling, the tide turned.
Yeah.
I hate that you're going through this. Unfortunately, it's not uncommon. And I appreciate you coming on because we really, in terms of quality of life, a lot of people are dealing with issues with their employer. And like Sarah said, I think you nailed it, Sarah. It's fine to a point for them, but they expect you to rebound and then go back to your normal productivity. And if you cannot do that, it's a problem for them.
Yeah, it kind of makes the support during treatment feel like a little bit of a farce. Like,
oh, sure. I mean, how do you feel?
Here we were for you through treatment, but if it's a long-term thing, I'm not here for you.
Well, I mean, ask anybody that deals with a chronic illness how they feel. It's called, like a lot of people will say it's an invisible disease. They look at me and think I look fine.
Yeah.
And therefore, you should be able to do this.
Yeah.
While secretly they're suffering and really struggling.
Right.
And there's just not a lot of compassion when that's the case. So how are you feeling emotionally about the whole thing, Kathleen?
I'm better now, initially devastated because the reality factor is that I feel, having gone through chemo, surgery, port placement, that I can relate to a lot of people with chronic illness 100% better than the colleague who honestly hasn't gone through anything.
Yeah, there's always that dichotomy. When you're dealing with people who haven't endured any kind of medical trauma, they just don't have the understanding.
No, but I've had wonderful conversations with patients. I had a follow-up MRI at the beginning of this month. And, people were asking me, a patient was asking me, well, how are you doing? And I said, hey, got this coming up. You're fine till you're not fine. And, his wife was like, I'm going to come back in the ER and make sure that you are fine. And I oh, it's people like you who make my day.
Yeah.
Right.
Yeah.
Right. Well, I am very, very sorry that you have to deal with this. Before we kind of close out the episode, though, let's hear from our second sponsor.
Innsbrook Resort is a proud sponsor of the Faith Through Fire Respite House and the Besties with Breasties podcast. We know you work hard, but at Innsbrook, we also know you want to disconnect from what's stressing you out and reconnect with the important things in your life. Innsbrook makes it easy by offering lakefront living and vacationing less than 45 minutes from St. Louis. Vacation homes, golf, swimming, nature trails, fun events, and more. Take a drive and discover Innsbrook. Visit Innsbrook-resort.com.
All right, we are back. Kathleen, is there anything, I feel like kind of you embody empowerment and asking for what you need within your work and kind of sticking to it and not, and making sure that you stay safe just for yourself, but also for your patients. But is there anything that you want to leave our audience with from today?
Yeah. Anybody else that's struggling with their employer or just anything that you've learned or that any final thoughts?
I think my final thought would be it's scary to have to think of doing something else with your life, especially, when you've been doing something for a long time. But don't be afraid to embrace change. There is a reason why things are going the way they are. And for me personally, it's wanting to spend quality time with my kids. It's sometimes hard to spend that quality time when you're working, till 9, or you've got the overnight shift and you come home, sleep for 5 hours. Losing income is always scary, but you're never too old for, finding something else.
Yeah.
And you're never gonna regret spending more time with your kids. You would, however, regret dealing with a company that would treat you so poorly at a very difficult time in your life. So I think,
especially after you've invested that many years.
Oh, sure.
Yeah.
Sure. Well, we're in your corner, Kathleen. We're rooting you on. We're gonna obviously keep up with you about how this evolves.
For
But
sure.
thank you for sharing your story. We really appreciate you.
I appreciate it. Thanks for talking with me, guys.
All right.
Yep.
Until
Till
next time, guys.
See ya.
Thank you for listening to the Besties with Breasties podcast. Leave us a voicemail or share your own experience on bestieswithbreastiespodcast.com. And don't forget to leave a 5-star review. This episode was hosted by Sarah Hall and Beth Wilmes, audio and production edits by Innovative Frequencies.